Hello, my name is Mildred, a community volunteer of VHT.
And I am Musa, a VHT as well.
Welcome to Health is Made at Home. To help us improve the health of our communities, this program has been prepared to build upon the knowledge and information you as VHTs already have on HIV.
In this session, we will listen to a short story, and then each one of you will have an opportunity for discussion as a group to learn and reflect on the new information and recommended behaviors that we will have shared.
Today, we will learn more about why it is important that all pregnant women be tested for HIV.
And how you as a VHT can support families in your community to ensure babies are born without HIV.
A woman with HIV can pass the virus to her baby during pregnancy, birth, or the breastfeeding period. HIV counseling and testing provides an opportunity for all pregnant women to learn their HIV status.
If infected, a pregnant woman may gain access to treatment to reduce the risk of transmitting HIV to her baby. HIV counseling and testing can also provide uninfected women with information to reduce future exposure to HIV.
To demonstrate this better, let's listen to this short play about Mary, and after listening to the story, we shall discuss some questions as a group.
Hello, my name is Mary. Like expectant mothers everywhere, when I discovered I was pregnant with my first baby, I began planning and having big dreams for my future son or daughter. I went to the health center thinking it was just a regular visit, but little did I know that it was going to be a life-changing experience.
Hello, Mary. Have a seat. I'm happy you have come back.
I have been so nervous waiting for my test results. Do you have good news for me, Sister Esther?
Well, Mary, do you remember what we discussed earlier?
Yes. You said that if the HIV test came back positive, then I would have HIV. But I just want you to know, Sister Esther, that if my test is positive and my husband finds out, I will be in big trouble. Please, tell me my test is not positive.
Mary, let's first go over some of the things we talked about last time. Is that okay with you?
Well, I really want to know because I'm very nervous right now. But okay, let us talk first.
Good. Do you remember what we discussed last time about the meaning of disclosure or telling people you have HIV?
You said it is important that I discuss my test results, whether positive or negative, with my husband. And we also talked about the things people can do to remain HIV negative and the things they can also do when they discover they are HIV positive. Sister Esther, now please tell me my results.
I'm sorry, Mary. Your HIV test did in fact come back positive.
Oh, Sister Esther, what will I do? My husband and I are so excited about this baby. This is our first baby.
I know this is very difficult for you, but I'm here to help you through this.
When I discovered that I was HIV positive, those dreams about my baby turned to sadness. Sister Esther told me that it was important that I told my husband about it and that he too had to get tested. It was not easy, but my husband and I discussed it. During the visit with Sister Esther, he also got tested and she told both of us that it was possible for me to pass HIV to my baby during pregnancy, labor, or during breastfeeding. I was devastated by the knowledge that I could punish my unborn baby to die before his or her life even began. But Sister Esther also told us that although I was HIV positive, it was still possible for us to have a baby that is born HIV free. She told us about medicine that I need to take to reduce the chances of the virus being passed on to my baby. But for this to happen, I had to have the baby at the health center with the help of a qualified health worker. We began to dream once more. When the time came to bring my child into the world, my husband took me to the health center and our newborn son, Godfrey, was also given the medicine immediately after birth. Today, Godfrey is healthy with big brown eyes and above all, he does not have HIV. Sister Esther told me to give him only breast milk, and my husband and I always remind each other to take our antiretroviral treatment. We are very happy because whenever we go to the health center for our regular checkups, Sister Esther is always available to answer the questions that we have about our condition.
Now that you have heard the story, please discuss the following questions as a group. The team leader will have to stop the CD or radio cassette player after each of the questions to give the group time to discuss the answers.
Is this story realistic? Does it happen in your community? Can one volunteer please share their experience with the group?
When should a person test for HIV?
Well done, all of you. Now, let us continue with the program. Mildred, why is the involvement of a male partner necessary in the prevention of HIV among babies?
The participation of both men and women is very important to the reduction of HIV infection in babies and children. For example, men play an important role by attending antenatal care with their partners
and supporting their partner's adherence to prevention of mother-to-child transmission, such as taking antiretroviral treatment as directed by the healthcare worker, delivering the baby in a healthcare facility, and exclusive breastfeeding.
Also, both partners participate in decisions that can prevent HIV transmission. Both partners play an important role in practicing family planning. Both partners should be tested and counseled for HIV.
Both partners need to be responsible for safer sex before, during pregnancy, and breastfeeding. Both partners should be given information about prevention of mother-to-child transmission interventions and services.
Both partners should be responsible for choosing a safer baby feeding method. It is important in seeking and participating in HIV-related care, treatment, and support.
Why is it important for an HIV-positive woman to deliver at a health center?
She will be given ARVs once in labor at the health center. If an HIV-positive mother delivers at a health center, the baby will be given antiretroviral treatment within 7 days of delivery.
She will be advised not to mix feed the baby. Mixed feeding is giving a baby of 0 to 6 months other foods in addition to breast milk. You can either totally breastfeed the baby for 6 months or totally give replacement feeds.
Babies who are on mixed feeding in the first 6 months are 4 times more likely to be infected with HIV than those fully breastfeeding. She'll be advised to avoid breastfeeding when the nipples are cracked or infected. And she will be advised on how to prevent any unintended pregnancies.
Now, can anyone in the group name at least 2 activities that should be done by a VHT when he or she visits the new mother who is HIV infected?
When you visit, make sure you assess the health of the new mother and newborn and discuss the following issues with them: family planning and supporting the mother's choice of contraception. Ensure adherence to antiretroviral treatment. discuss the importance of safer sex to prevent STIs and the further spread of HIV with her, and also give her advice about early treatment of STIs.
In this session, we have learned that even if you are HIV positive, it is possible to have a baby that is born HIV-free. This is called prevention of mother-to-child transmission of HIV.
This process requires that pregnant women test early in pregnancy for HIV, and if positive, begin treatment and follow the treatment guidelines for their newborn baby, which can almost reduce the risk of the mother's HIV being passed on to her child.
We shall leave you with 2 questions which we would like you to discuss together at the end of this program. So please write them down. These questions and more detailed information on this topic can also be found in the discussion guide.
Question 1. What are the stages that have to be followed when taking PMTCT? Question 2. What are the important things to remember once one has had the baby?
Thank you very much for listening. We will leave you with one of my favorite songs.
And remember, health is made at home. So please share what you have learned today with your partners, community members, and friends. Until next time,
Goodbye.
Of a dancer we did down Gauteng way. Everybody starts to move as soon as Pata Pata begins to play.
program was produced by Health Child. This is a non-governmental organization whose work in Uganda contributes to the reduction of common child illnesses and death of mothers and children by improving the ability of community health workers to access relevant information about health directly within the community.